systems in... Hello everyone. In this chapter we'll talk about various systems in human body, including the digestive system, urinary system and reproductive system.
We'll also cover medical emergencies including coronary artery disease, stroke, transient ischemic attack, breathing difficulty, hyperventilation, epilepsy, febrile convulsion, diabetes and poisoning, as well as their management.
Digestive system includes mouth, esophagus, stomach, pancreas, liver, gallbladder, small intestines, colon, rectum and anus. It's a system that handles and processes the food we swallow. When food passes through the digestive tract, it'll be decomposed in physical and chemical way, turning into nutrients that can be absorbed in blood and utilized by our body. The substances that can't be digested or absorbed will be excreted as excreta. The functions of digestive system include ingestion, digestion, absorption and excretion. First, ingestion is the intake of food to the digestive tract. The second step is digestion, which can be further divided into physical and chemical senses. Physical digestion is the mastication and further breakdown of food in the digestive tract, while chemical digestion refers to the decomposition of food by chemical substances or enzymes secreted by digestive glands along the digestive tract. Third, absorption is the process in which the digested food is absorbed into the bloodstream and lymph vessel through the wall of the digestive tract. Fourth and finally, excretion is the passing out of food that can't be digested or absorbed as excreta. We'll now talk about the urinary system. It's one of the four major excretion systems in human body. Organs in the system include 2 kidneys for urine production, bladder for temporary storage of urine, and 2 ureters to pass urine to the bladder. When the storage in the bladder has reached a certain level, urine will be excreted through urethra. Reproductive system is a system for childbirth. Female reproductive organs include ovary, fallopian tubes, uterus, vagina, vulva, labia majora, labia minora, and clitoris. Male reproductive organs include testis, epididymis, sperm duct, seminal vesicle, prostate, Cowper's gland, scrotum, and penis. I believe many of you are familiar with the human reproduction. The sperm travels through the vagina and cervix into the uterus or fallopian tubes, and the egg cell simultaneously moves through the fallopian tube away from the ovary. Once the sperm encounters, penetrates and fertilizes the egg cell, a zygote is created. Upon fertilization and implantation, gestation of the fetus then occurs within the female's uterus for around 40 weeks. The fetus passes through the vagina during labor and a newborn baby was born.
Now, let's go through the medical emergencies, which include coronary artery disease, stroke, transient ischemic attack, breathing difficulty, hyperventilation, epilepsy, febrile convulsion, diabetes and poisoning.
We'll also talk about their respective management.
First, coronary artery disease, CAD, is caused by the progressive narrowing of the coronary artery and turns into different clinical conditions such as stable angina, unstable angina, or even myocardial infarction provokes cardiac arrest. Acute coronary syndrome refers to mainly 2 clinical presentations, myocardial infarction and unstable angina, which are caused by the disruption of atherosclerotic plaque of coronary artery. The disrupted plaque may cause platelet aggregation and develops into thrombus. When the blood supply to the cardiac muscle is totally blocked by the thrombus developed in the coronary artery, acute myocardial infarction, AMI, may occur. Signs and symptoms of acute coronary syndrome include crushing pain in chest and cannot usually be relieved after rest. The chest pain can last for 30 minutes to several hours, and the pain may radiate to jaw, shoulders, or left arm. The victim will have nausea, throwing up, sweating, breathlessness, and the pain cannot be relieved by taking glycerol trinitrate, TNG, and may turn into cardiac arrest. To manage acute coronary syndrome, you should immediately call 999 and inform that the victim is a suspected case of acute coronary syndrome and ask a bystander to get an AED. Then place the victim in a sitting or semi-lying position. Ensure the victim rests completely while comforting and reassuring the victim. After that, maintain the victim's airway patent. Remove tight clothing around neck, chest, and waist. If victim is conscious and has medication, TNG, with him or her, help him or her to take it sublingually. Do not leave the victim alone if possible. If the victim gets cardiac arrest, start CPR and attach to AED immediately. Then send to hospital at once.
You all right with all those bags?
Yeah, fine.
Amit, what's wrong?
Chest is...
I'm coming round. Come on, sit down. Sit down for me, all the way down. That's it. Excuse me, have you got a mobile? Can you call an ambulance? I think my friend's having a heart attack. Okay, it's all right. Somebody's calling an ambulance, okay? Ambulance, please. And I'm going to be here with you, okay? So it's going to be here really soon, then we're going to get you to the hospital. So don't worry, and I'm going to be right here. I'm staying right here with you, all right? Okay. Won't be long, all right? Okay? Okay.
Heart diseases can be fatal. That's why we should take good precaution. For example, check your blood pressure regularly. Don't smoke, and beware of cholesterol level in diet.
You should also maintain regular exercise, pay attention to your own weight, and relieve stress.
As prolonged stress may affect various body functions, causing insomnia or poor appetite, and such conditions may cause heart diseases indirectly.
Transient ischemic attack, TIA, is caused by a temporary disruption in the blood supply to part of the brain. Such sudden onset results in a lack of oxygen supplied to the brain and causes neurological deficit. TIA does not last as long as a stroke. The effects last a few minutes to a few hours and fully resolve within 24 hours. TIA is a warning sign that you may be at risk of having a stroke in the near future. It is important to call 999 and go to hospital immediately if you or someone else has symptoms of a TIA or stroke.
Stroke occurs when the blood supply to the brain is disrupted by blood clots known as ischemic, or when ruptured blood vessel causes bleeding into the brain, which is also known as hemorrhagic. Either ischemic or hemorrhagic stroke will cause damage of the affected brain cells. The severity of the damage depends on the area affected. This condition is more common among the middle-aged and the elderly. To identify the signs and symptoms of stroke, you can use the FAST guide. F refers to face, which means whether the victim is unable to smile evenly and the mouth or eye may be droopy. A stands for arm, which means whether the victim is only able to raise one of his or her arms. S represents speech, which means whether the victim is unable to speak clearly or may not understand the spoken word. T refers to time, which implies it's time to call 999 for emergency help if you suspect that the victim has had a stroke. Apart from what is mentioned above, there are other signs and symptoms including headache, dizziness, confusion, paralysis of the mouth, drooling, projectile vomiting, and slurred speech. The victim may also show unequal pupil sizes. He or she may have weakness, numbness or paralysis of face, one limb or one side of the body, or even incontinence. There may be signs of increased intracerebral pressure in severe case, including irregular breathing and breathing difficulty, or slow and strong pulse. To understand the FAST guide better, you can refer to the following video.
Mrs. D. Oh man. Mrs. D. Fast. F. Face. It looks a bit droopy. Can you give us a smile, Mrs. D? A. Arms. Mrs. D. Can you raise your arms for me, Mrs. D? That's it. And the other one? S. Speech. Mrs. D, speak to me. Tell me how you're feeling. T. Time. Time to call the ambulance. Don't worry, Mrs. D, I'm not going anywhere. I'm just getting us some help. Hello? Can I have an ambulance, please? I've done the fast test and I think it's a stroke. Mrs. D, don't worry. I'm not going anywhere, Mrs. D. It's okay. Help's on the way. It's going to be fine.
If the victim shows signs and symptoms of stroke, call the ambulance as soon as possible. Then help the conscious victim to lie down in a comfortable position and in complete rest until the ambulance arrives.
If he or she becomes unconscious, place him or her in a recovery position and maintain airway patency. After that, remove any tight clothing around the neck, chest, and waist. Reassure the victim and avoid unnecessary movement. Remember not to give the victim any food or drinks. Send him or her to hospital immediately. Another medical emergency is dyspnea. There are numerous factors that lead to the condition, but it's mostly caused by heart diseases or respiratory diseases such as asthma, chronic neurological diseases, or lung diseases. Signs and symptoms of the condition include rapid noisy breathing, agitation, excessive secretion of sputum, and sweating. In severe case, the victim will use accessory muscles on his or her shoulders and neck to assist breathing. He or she would also show cyanosis and decreased level of consciousness. To manage dyspnea, perform DREB-CDE first. Make sure that the victim has an open airway. After that, place the victim in a comfortable position for breathing, usually in a sitting position. Loosen any tight clothing around neck, chest, and waist. Meanwhile, keep the victim warm. Comfort and reassure him or her. Closely observe for any changes in breathing, pulse, or consciousness, and send him or her to hospital immediately. If the victim has a prescribed medication or bronchodilator with him, assist him to take or use it. Hyperventilation is commonly a manifestation of acute anxiety and may accompany a panic attack. It can happen to anyone. The unnaturally fast or deep breathing of the victim causes an increased loss of carbon dioxide and triggers the attack. Signs and symptoms of hyperventilation include unnaturally fast and deep breathing, trembling or tingling in mouth and hands. The victim may experience agitation and panic, or even cramping hands and feet in severe cases. However, there's no cyanosis. To manage hyperventilation, let the victim sit down and rest. Reassure him or her. Advise the victim to breathe slowly by his or her nose. If you can't identify the cause of rapid breathing, send the victim to hospital at once. Note that there are different causes of rapid breathing. Hyperventilation isn't the only cause. Epilepsy is a sudden disturbance in the electrical activity of the brain. The cause of epilepsy is either congenital or head injury. A stimulant overdose can also cause epilepsy. Congenital epilepsy can be divided into two types: petit mal seizure, also known as absence seizure, and grand mal seizure. The onset of petit mal seizure may not be noticed easily, as the victims appear as if he or she was daydreaming. The onset can last as short as a few seconds. Signs and symptoms of the condition include staring blankly ahead and pale skin. The victim may be also suffering from temporary memory loss and odd automatic movements, such as lip smacking or making noises. To manage petit mal seizure, protect the victim from any dangers or hazards. After that, talk to the victim in a calm and reassuring way. And stay with the victim until he or she has fully recovered. Meanwhile, advise the victim to seek medical advice. In case of grand mal seizure, there's often a brief warning before seizure, such as precognition of seizure, headache, irritated, grumpy, losing tranquility, delusion. In serious cases, the victim may suffer from generalized seizure and coma. Grand mal seizure can be divided into two phases. The first phase is called the tonic phase. The victim may scream, experience a sudden loss of consciousness and fall on ground, or even become rigid for a few seconds with congestive neck and face and cyanosis. There may be frothy and blood-stained saliva if the tongue is bitten, and also incontinence. This phase may last for several minutes. The victim will then relax and proceed to the clonic phase. When the victim enters the clonic phase, he or she may feel tired and fall into deep sleep due to exhaustion. The muscle of the whole body will relax. The victim will be unaware of the occurrence when he or she regains consciousness, and may even feel dazed and confused or act strangely. Now let me demonstrate how to manage grand mal seizure.
Management of epilepsy. Protect the head of the victim. Don't restrain the victim to avoid causing harm to him or her. Remove the victim from dangerous places and remove potentially dangerous items for the victim. You can use a towel to protect the victim's head. If there's no towel at the scene, you may put your hands under the victim's head as protection. Don't open the victim's mouth forcefully, or put fingers or any objects into his or her mouth. Remove constraining objects on the victim, such as glasses, tie, tight clothing. Stay with the victim until he or she regains consciousness or the ambulance crew arrives. If the victim becomes unconscious, follow the management of unconsciousness and send the victim to hospital as soon as possible.
Fever is a common medical condition. It means the body temperature is higher than normal level and usually happens when our body is fighting against the bacterial or viral infection. There are several ways to measure body temperature. What is the range of body temperature that will be considered as fever? For auditory measurement, any reading that is higher than 38 degrees Celsius or 100.4 Fahrenheit will be considered fever. For oral measurement, the upper limits are 37.5 degrees Celsius and 99.5 Fahrenheit respectively. For rectal measurement, the upper limits are 38 degrees Celsius and 100.4 Fahrenheit respectively. As for axillary measurement, any reading that is higher than 37.3 degrees Celsius or 99.1 Fahrenheit will be considered fever. To manage fever, measure body temperature every 4 hours. Give the victim plenty of water. Meanwhile, don't wear heavy clothing, as it'll interfere heat loss. The victim can sponge or bath with tepid water between 32 and 35 degrees Celsius, so as to lower the body temperature. But don't sponge or bath the victim with cold water or ice water, as there is a risk of overcooling. Also, don't wipe the body with alcohol. If the victim has already consulted doctor and has prescribed medication, take medication as prescribed. But the victim should consult a doctor immediately if the situation doesn't improve or other signs and symptoms appear, for example, rash and confusion. We'll move on to talk about febrile convulsion. Young children may suffer from febrile convulsion due to high fever associated with infectious diseases, a bacterial or viral infection of throat or ear. It's similar to epilepsy and commonly found in children between 6 months to 5 years old. Febrile convulsion may recur if the fever is not subsided. Signs and symptoms of febrile convulsion include twitching of the face and limb muscles, squinting and fixed or upturned eyes. Body becomes rigid and arched back. Victim may have breath holding with red puffy face and neck and drooling at the mouth. Victim will also show obvious signs of fever, such as hot flushed skin and perhaps sweating. To manage child with febrile convulsion, first we should maintain good ventilation in the room, remove any tight clothing. When a child is in seizure, protect him or her from injury and do not restrain the victim. Reassure the parents at the same time and do not put fingers into the victim's mouth. After the seizure, place the child victim in a recovery position or lying on one side with airway opened. If the victim is conscious, sponge or bath with tepid water to lower the body temperature. If the convulsion persists, send the victim to hospital as soon as possible. Then we'll talk about diabetes mellitus. Food being digested will break down into sugar and being absorbed into the bloodstream. Pancreas produces insulin, which allows sugar to diffuse into our cells, providing the nutrient for normal functions of our body and brain. The remaining sugar will be stored in the liver. Failure to produce sufficient insulin by pancreas or body cells not responding properly to insulin may interrupt the intake and the use of sugar by our body cells. Sugar may then accumulate in blood and lose in urine. Diabetes mellitus is characterized by high blood sugar levels over a prolonged period, and it can induce hyperglycemic coma or hypoglycemic coma. Hyperglycemic coma is due to insufficient insulin secretion by the pancreas, causes interruption in the use and absorption of blood sugar by body cells. As a result, the blood sugar level will increase and lead to serious complications and coma. Typical causes of the condition include overeating, inadequate injection of insulin, and dehydration. Signs and symptoms of hyperglycemic coma include flushing skin, dry skin, sunken eyes, frequent urination, thirst, deep and short breaths that is similar to sighing with acetone smell. Victim will also have rapid and weak pulse, become unconscious gradually, experience nausea, vomiting, and abdominal pain. These signs and symptoms will intensify gradually. To manage a victim with the condition, send him or her to hospital as soon as possible, as the victim needs to replenish insulin and may require other medical care. If the victim becomes unconscious, follow the management of unconsciousness immediately. Hypoglycemic coma occurs when the blood sugar level falls below normal in result of overdose of insulin, insufficient food intake, or sudden increase of physical activities. The condition will affect brain functions. If it persists, the victim may have brain cells damaged and turn to unconsciousness or even death. Signs and symptoms of hypoglycemic coma include faintness, pallor, rapid pulse, confusion and irritability, cold and clammy skin, and muscle tremors. Victim may end up in coma. To manage victim with hypoglycemic coma, provide drinks with high sugar content to conscious victim, such as glucose drink. If the victim is unconscious, follow the management of unconsciousness immediately. Another medical emergency is poisoning. What exactly is poisoning? A poison can be in the form of solid, liquid, or gas. If taken into or absorbed into the body in sufficient quantity, it can cause either temporary or permanent damage, and in severe case, even death. Poisoning refers to the intake of excessive amount of toxin, which causes adverse effect in the body. There are 4 typical media of poisoning. The first medium is poisoning through ingestion, such as drug poisoning, food poisoning, alcohol poisoning, or intake of corrosive substances. The second is through sting or bite by poisonous creatures. The third is poisoning through inhalation, such as the inhalation of poisonous gas. Or lastly, the absorption through the skin or mucous membrane into the body, such as the absorption of chemicals by skin or mucous membranes, or contact with corrosive substances. How can we manage victim with poisoning? If it's poisoning through inhalation, confirm if the victim has gaseous poisoning and don't enter into the scene if it isn't proved safe. If the scene is confirmed safe, move the victim to a ventilated place immediately. First, perform primary survey. If the victim has no breathing, perform CPR immediately. If the victim becomes unconscious, treat accordingly and be alert to the surrounding evidences. If the victim has poisoning through ingestion, ask the victim what he or she has taken when he or she is still conscious. Don't stimulate vomiting to prevent aspiration. If you have witnessed an adult victim drinking any caustic agents, you should not provide anything for dilution. Just help the victim to maintain his or her airway open. Apart from maintaining an open airway, send the victim together with the empty bottle and a sample for vomitus to hospital as soon as possible. If the victim has poisoning through ingestion and has become unconscious, don't try to stimulate vomiting. Place the victim in a recovery position. Monitor the victim's breathing and signs of circulation. If victim stops breathing, perform CPR immediately. If the victim has poisoning through skin or mucous membrane absorption, move the victim to a safe place and remove all contaminated clothing and accessories. Wash the substance around the injured site away with plenty of running water. Send the victim together with the container of the poisonous substance to hospital as soon as possible. If the victim has poisoning through bite or sting by poisonous creatures, reassure him or her first. After that, scrape the tick off carefully with the edge of a card or remove it by fine forceps. Meanwhile, take off all the rings and accessories on the injured limb. Apply a cold pad on the wound.
If the victim is stung by poisonous fish, immerse the wound in warm water at around 45 degrees Celsius to relieve pain and send him or her to hospital as soon as possible.
Some precautions should be carried out to prevent ourselves from poisoning. First, drugs should be stored properly at places out of reach of children and locked. Put medicines in labelled bottles. Don't mix different drugs together in the same bottle. Don't take any medications without the doctor's prescription. Store antiseptics and cleansing agents properly at places out of reach of children. Don't put detergent or chemical products in a food container. If you need to store or use a large amount of gaseous substances, follow the safety guidelines of the Labour Department.